Hello, dear mothers and future moms. Today, we're going to discuss a topic that can be quite concerning but is very important to understand: bleeding in early pregnancy. If you're experiencing this, you're not alone, and our goal here is to help you understand the possible causes and what steps you should take next. Understanding early pregnancy bleeding. First, let's talk about the difference between what might be considered normal bleeding and what could be more concerning. One example of normal bleeding is implantation bleeding, which happens when the fertilized egg attaches itself to the uterine lining. This typically occurs around the time your period would have been due and often looks like light spotting. However, there are other types of bleeding that might indicate a more serious issue. It's important to be aware of warning signs. When should you be concerned? If you're experiencing heavy bleeding, similar to or heavier than your regular menstrual flow, it's time to pay attention. This could be a sign of a potential miscarriage or an ectopic pregnancy. Other symptoms to watch out for include severe cramps, back pain, or dizziness. Common causes of bleeding in early pregnancy. Let's talk about some of the main causes. Miscarriage. Unfortunately, about 10 to 20% of known pregnancies end in miscarriage, often before the 12th week. Signs include heavy bleeding, severe abdominal pain, and passing tissue. Ectopic pregnancy. This occurs when the fertilized egg implants outside of the uterus, usually in the fallopian tube. It's a serious condition that can cause sharp abdominal pain and heavy bleeding and requires immediate medical attention. Subchorionic hemorrhage. This is when there is bleeding between the uterine wall and the membrane around the embryo. Many women with this condition can still continue to have healthy pregnancies, but it's something that needs to be monitored. Molar pregnancy. This is a rare condition where abnormal tissue grows inside the uterus instead of a normal embryo. The bleeding might be dark brown to bright red and could be accompanied by severe nausea and rapid uterine growth. What should you do if you experience bleeding? If you experience bleeding, here are the steps to take. Monitor the bleeding. Keep track of the amount, color, and whether you notice any clots. Also, pay attention to any other symptoms such as pain or dizziness. Contact your healthcare provider. Don't hesitate to reach out to your obstetrician or midwife. Let them know about the bleeding and any other symptoms you're experiencing. Follow up with an ultrasound and blood tests. Your healthcare provider may recommend an ultrasound to check the status of your pregnancy. Blood tests can also help monitor your HCG and progesterone levels, which are important for understanding how the pregnancy is progressing. Rest and avoid strenuous activities. Sometimes, rest and avoiding heavy lifting or vigorous exercise can help reduce bleeding. Always follow your healthcare provider's guidance. Seek immediate medical attention. If you experience heavy bleeding, severe abdominal pain, or dizziness, seek medical help immediately. These symptoms could indicate a serious condition, like an ectopic pregnancy or miscarriage. Emotional support. Experiencing bleeding in early pregnancy can be very stressful and emotionally draining. Don't be afraid to reach out for support, whether it's through counseling, support groups, or talking to family and friends. You don't have to go through this alone. Conclusion. Bleeding in early pregnancy can be scary, but understanding the potential causes and taking the appropriate steps can help you manage the situation effectively. Always consult with your healthcare provider if you experience any bleeding during pregnancy. For more information and to stay updated on similar topics, make sure to subscribe to the channel and turn on notifications. See you in the next lesson.